Good morning, church family. Thank you for allowing me to slip in for the Health Nugget this morning. I wanted to share with you and was asked if I would share some of the services and resources at Ridley Tree Cancer Center. I worked there for many years before I retired, and after I retired, I went back to work for a while, but wanted to share with you some of the services there. First of all, the radiation oncology department is a very busy and important department. The radiation oncologists are board certified in their specialty, who specialize in treatment with radiation therapy for cancer patients. They are trained in delivery of stereotactic body radiation therapy, SBRT, brachytherapy for prostate seed implants for prostate cancer, and external beam radiation therapy, high-dose radiation therapy for gynecologic cancers. They are a highly focused treatment aimed precisely at the cancer cells to minimize exposure to healthy tissue. It is measured in sub-millimeters of accuracy. After a consult with the radiation oncologist who reviews all the patient's medical records, pathology reports, labs, imaging, and reviews that with the patient at that consult, if treatment is agreed upon, a CT planning appointment is made. That appointment is not for diagnostic purposes, but for treatment planning purposes. That CT is interfaced with the other imaging that the patient has had previous to seeing the radiation oncologist. The radiation oncologist designs the treatment plan. Everybody has an individual devised treatment plan. The radiation oncologist works with the dosimetrist and the medical physicist in making up that treatment plan. The medical physicist helps with the safety issues. There are many points to consider in developing a plan for radiation therapy. They need to avoid critical structures, and there are doses limited to certain structures of the body. So it's all very precise and purposeful. That area of planning is a very specialized area, and it's very impressive as well. There are two linear accelerators, the Electa Versa High Definition Linear Accelerated, the only two in this central California area. Another department is medical oncology and hematology. They treat patients with many types of cancer and blood disorders. Medical oncology team comprised of highly trained board-certified physicians, advanced practice providers, oncology nurses, pharmacists, and other healthcare professionals. Treatment consists of chemotherapy, hormonal therapy, immunotherapy, which is also called biologic therapy, and targeted therapy, and other supportive treatment. Some patients receive chemotherapy alone. Some receive chemotherapy along with radiation therapy concurrent at the same time, and some after, depending on the disease and stage of the disease. The team works closely with the surgical oncology and radiation oncology departments, as well as other supportive care departments. They also work with other specialists in the community to provide coordinated, comprehensive cancer care. The medical oncologists are also hematologists, oncologists, also treat non-malignant cancers of the blood. Their offices are in Santa Barbara, and there's also an office in Solvang. Surgical oncology is another department where trained physicians are highly specialized members of the multidisciplinary team. Depending on diagnosis, the surgical oncologist provides services throughout all stages of cancer, from prevention through diagnosis, rehabilitation, and ongoing monitoring through survivorship. The surgical oncology department is also based at Ridley Tree Cancer Center. Another department is breast surgery, located at Ridley Tree. Surgical treatment, together with medical or radiation oncology, are the mainstay of breast cancer care. Depending on the type of cancer, surgery can be recommended either before or after chemotherapy. The multidisciplinary team consists of radiation oncology, medical oncology, radiologists, pathologists, researchers, patient navigators, genetic counselors, oncology, nutrition, physical therapy for lymphedema. They also care for patients with benign breast disease, including complications with lactation. Also, another resource is nuclear medicine department. That's located at Cottage Hospital. The Cancer Center used to be located at Cottage Hospital. When they moved to the Ridley Tree building, nuclear medicine stayed at Cottage Hospital as they treat many patients there in the hospital. Their expertise is in advanced imaging techniques, including PET-CT and SPECT-CT, used to diagnose a variety of diseases, including cancer and heart disease. Specialized area of radiology that uses very small amounts of a radioactive substance, radionuclide, to look at organ function and structure. They are accredited by the Intersocietal Accreditation Commission. Another department is palliative care. This type of health care is focused on improving your physical, psychological, social, and spiritual health while receiving cancer treatment. It improves quality of life, improves ability to tolerate medical treatment. Different from hospice care, which is care for those with a life-limiting illness and a 6-month prognosis or less. If you do not have to give up your existing healthcare provider to have palliative care, and it is appropriate at any time during one's cancer treatment, especially during cancer treatment. The palliative care department is very important. The team includes a board-certified adult nurse practitioner, board-certified registered nurses, palliative care social worker, clinical coordinators, and medical assistants. I've worked with these ladies, and they are compassionate with their patients and passionate about caring for their patients. They work with the patients and their families and their care team to provide relief from symptoms such as pain, nausea, shortness of breath, loss of appetite, treatment for depression and anxiety related to cancer. They give emotional and spiritual support, enhanced communication with doctors and family members, guidance with difficult treatment decisions, help with navigating the healthcare system, help with advanced care planning services also, align medical care with the individual patient preferences. They discuss healthcare goals and preferences, complete a POST, which is a physician's order for life-sustaining treatment. They collaborate with the primary care providers, specialists, and cottage healthcare team professionals and program directors, as well as other community providers who provide supportive care services. They also have strong working relationships with other providers such as palliative and hospice care in the community, including Hospice of Santa Barbara, VNA Health, and Serenity House, and the Allied Alliance for Living and Dying Well. There are also clinical supportive services. They are the clinical research department. They determine effectiveness of new medical treatment. When a patient is interested in a trial, there's a vast amount of paperwork, as you can imagine, and every point of the trial must be met. The clinicians follow their patient through the trial to maintain accuracy of that trial. Support services is also another very important part offered by Ridley Tree. Cancer can significantly require psychological, social, and economic challenges for patients and their families. Care for the whole person, not just the diagnosis, is an important aspect of the patient's plan of care. For this reason, clinical social workers who provide emotional and practical support for patients, their families, and friends. Oncology social workers can provide advocacy and referrals, as well as individual and family counseling services. Genetic counseling is another support services departments. 5 to 10% of all cancers are hereditary, caused by inherited genetic changes. Genetic counseling and cancer risk assessment is an important part of cancer care. It helps patients and families with a history of cancer better understand and manage the risk for developing cancer through cancer risk assessment and genetic testing. Patient navigation is another clinical support service. That's what I was involved with for the last 10 to 12 years of my nursing career as an oncology nurse. Navigators assist patients and their families by interpreting information about cancer diagnosis and treatment plan, ensuring that imaging, medical, and follow-up appointments are timely, identical local resources, and making referrals. They collaborate closely with the patient's physicians in different specialties to coordinate care. I've had many patients who say, I wouldn't have known what the next step that I should take if I didn't have this service. And finally, the last clinical resource is oncology nutrition. They are an integral part of the patient's cancer care. It is estimated that 50% of patients are malnourished at the time of diagnosis. Oncology nutrition help improve the nutritional status of the oncology patients, which may reduce treatment side effects, improve quality of life, and treatment outcomes. I've always encouraged my patients to continue with the oncology nutritionist even after treatment. The oncology dietitian nutritionists specialize in nutritional counseling for cancer patients and offer personalized care through evidence-based recommendations that are drawn from scientific research and clinical experience. I know I've rushed through this. I have a limited amount of time, but we are so blessed in Santa Barbara to have this comprehensive cancer care. And I pray that none of us ever have to take advantage of it, but if we do, it is there for us. Thank you.